Welcome to the TMJ Therapy. I'm happy to share with you my knowledge and research about temporomandibular disorder, what it is, and how it can be quickly and easily resolved here with the TMJ therapy process. First, I'll start with what is TMD? It stands for temporal mandibular joint disorder or dysfunction. We have two TMJs, temporomandibular joints, one on each side of our face, right in front of our ears. We call those TMJs. But when there's a disorder or dysfunction, that's when it's called TMD. Now, what is TMD? Well, it's anatomical, biological, emotional, and behavioral. Anatomically, it means that there's a dysfunction with or without pain in the system of your jaw as it hangs from your head or cranium, as that balances on your neck and shoulders all the way down to your low back. It means that there's a dyssymmetry of those jaw joints and also with your postural disposition. It means there's an imbalance in the associated muscles and soft tissue that support that, and pressure on a nerve causing neurological defect. Biologically and emotionally, well, the brain and the body are connected. There are biological effects of emotion and physical stress on our body. Chemicals from these emotions cause physical symptoms. So, behavior modification of these emotional and physical stress is necessary. So, behaviorally, what needs to happen is to modify or change the physical and emotional components. In order to do that, we have to know what they are, replace them with a new thought or behavior, and then practice that for 21 to 28 days, consciously and consistently. Then that's reprogrammed into our subconscious as the new unconscious behavior and thought. I designed the TMJ therapy to be the most affordable, comprehensive, holistic, and interactive process that works if you work it. Some jaw-dropping facts about temporomandibular joint disorder is that 12% of the population has been diagnosed with TMD, but we think that 33% of the population has it. They're just not being diagnosed because there's not one health profession that has it as their main course in their curriculum. Not chiropractors, not dentists, not physical therapists or orthopedists. Well, it's because it's a very complex condition, and in order for complete resolution, you have to attack all of the things at once: the physical, biological, behavioral, and emotional. And that's what we do here at the TMJ Therapy. We don't offer you devices, braces, drugs, or surgery. Usually that's not even necessary. At the TMJ Therapy, we're going to systematically address the whole TMD system at the same time: the physical, the biological, and the behavioral. So, anatomically and physically, this is the most complicated joint in the body, not only because there's one side that articulates and has a disc, but there's also another side that articulates and has a disc. So, whatever one side does, the other side has to do the opposite, or the same, or a combination of all of the movements that there are. For full TM disorder resolution, I like to think of the body like a house. I start at the foundation, which is the bone structure. So at the core level, I'm going to be aligning the joints from the bottom to the top. Then I'm going to work on the supportive soft tissue, like the walls of the house. So I'm going to work on muscles and tendons and ligaments in the disc. And then we have to make sure the electrical system is operating properly. We want the nerve function to be swift and timely and balanced. So we're going to work on the full house or your full body, because the jaw is a part of the head is a part of the body. They all function harmoniously with one another, and when one part of the body is out of balance, it affects the other parts. It's a full body assessment because it's all connected from the tailbone up to the cranial bone. Because wherever the head is in space, the jaw will follow. The head is dependent on where it sits on the neck and shoulders, all the way down to where your feet hit the floor. This slide is a simplistic diagram of the movers and the stabilizers of the jaw. As you can see, the cranium and the mandible are connected with muscles inside the mouth, on the head to the jaw, on the head down to the vertebra of your neck, from your vertebra and the back of your head to your shoulder girdle, in front of your neck to the hyoid bone, to the shoulder girdle, to the mandible. Oh, what a mishmash. It's all connected. There's 68 pairs of muscles that make the jaw do what it's supposed to do. So we can't just look at the area of chief complaint. We have to look at it all. And how those muscles work is where they're attached to the bones and where those bones are sitting in space. So if you have what's called upper cross syndrome, which is the head is forward of the shoulders, well, like when you're sitting at a computer all day, or you're looking down at your tablet or your phone, prolonged amount of time doing these kind of things are going to inhibit certain muscles, which are the neck flexors and the ones between your shoulder blades, and then it's going to tighten up the ones in the front of your chest and the back of your neck and shoulders. And so if I suggest to you that standing up straight and working on your posture and sitting up straight will help your jaw fall into its more natural position, well, you would do it. The problem is because these muscles over time have gotten so tight, and then the opposing ones have basically just turned off neurologically, or dimmed, I should say, then these need to be worked on here. So we help you to uncross the upper cross. There's also a neurological connection we have to take a look at. Since the nerves are an electrical communication system from our brain, sending down the commands of what our brain wants our body to do through the spinal cord and out through the nerves that exit the vertebra of the spine, they tell our body what to do and then receives the input from what our body is doing and sends it back up to the brain. It's an information feedback loop that works really well. Well, unless it doesn't, because the nerves of the face share the same pathway in the brain with the nerves of the neck. And what can happen is if the neck bones are pinching on a nerve, that information goes up to the brain says, great, I'll take that pinch off of the nerve of the neck by moving this muscle in the neck. Uh-oh, took a wrong turn on the clover leaf and went down into the mouth muscles. And so the jaw muscles are tightening up rather than the ones in the neck. So you may have symptoms in the jaw, but the neck is really the problem, and vice versa. It's like a kink in the water hose will only let out a few drops of water. The nerves, when they're kinked, will let out the information, except it's deficient or it's detoured or disrupted or delayed. So it's not working as quickly and succinctly as it should. That's where symptoms come in, because symptoms are a message from our body that there is a problem and change is needed. And when we look at TMD list of symptoms, oh my goodness, we're talking from the head all the way down to the low back can be affected by symptoms. And so as you're filling out the consultation form and you see that you have what may have been diagnosed as a migraine, well, it certainly can be a migraine, but what's it caused by? Your jaw is clicking and popping, or you have pain in your cheeks. What's that caused by? You have discomfort in your mouth. You might have limited opening, or it doesn't move smoothly, or it locks or stick, or teeth don't fit together comfortably. You might be clenching and grinding at night. You might have loose and sore teeth. You might have symptoms in your throat. It might be difficult to swallow, or occasionally you'll have a sore throat on one side. There's no infection. Or your voice might change or have irregularities. Just feels this fullness in your throat. In your eyes, you might have pain behind them. You might be sensitive to light. In your ears, you might have hissing occasionally, or buzzing, or constantly ringing. Or it might sound like the sounds are being decreased or plugged up ears. Or you might have ear pain or ache and there's no infection. Vertigo, dizziness, constant itchy ears. Well, I have to tell you that 70% of all TMD patients report ear symptoms. And so down to the neck we go. With your neck, you already know that that's connected through this whole system of muscles. So you might have lack of mobility and pain and tired muscles and shoulder tightness or a history of whiplash or tingling or numbness in your fingers. Let's go down to your low back. Even your low back, as it's all connected, you may have a history of a tailbone problem or an accident or a fall. What I'm saying is that the symptoms are a message that there's a problem, and so we need to get to the root cause of what's causing these symptoms. You also need to know that there is a historic progression of degeneration. So, any joint that is not lining up correctly and is being used that way over and over again will wear out that joint quicker than if it's used in the correct alignment. So, our goal here is if you have a history of this, to stop that progression. Here's a sample of how, as much as the symptoms vary, it could look as simple as this. Here are the stages of degeneration that occur when a joint is out of alignment for a long period of time. And the symptoms vary greatly with different people, and the time periods vary greatly, but over the course of time, this is the average of what we see, especially for the TMJ joint. First stage of degeneration is your jaw moves fine, there's no pain, but there's some annoying clicking and popping sounds, or it might stick or lock every once in a while. The second stage of degeneration can be where the jaw doesn't have as much movement at times, and there's also a pain associated with it, with the clicking and popping and sticking and locking. The third phase of degeneration is now your jaw movement is very limited and there's pain. Now, it'll click and pop when it moves, but sometimes it doesn't, so it doesn't have the sounds, and then it gets worse and worse. And so, whatever stage of degeneration you might be in, we can never go back to where it was before, but we can help you stop the progression of the degeneration, and that's essential.